How does secondary bone cancer develop? Imagine cancer cells as tiny travelers that can leave their original home and settle somewhere new. Secondary bone cancer, also called metastatic bone cancer, happens when these cells travel from a primary tumor in another part of the body to the bones. The process begins when cancer cells detach from the main tumor, which is often found in the breast, lung, prostate, kidney, or thyroid. These cells then invade nearby tissues, breaking away from their original site. Next, they enter the bloodstream or lymphatic system, which acts like a highway for cancer cells to reach distant parts of the body. Once in circulation, they travel through the blood or lymph to reach the bones. When they arrive, they exit the blood vessels and infiltrate the bone marrow, which is the soft tissue inside bones where blood cells are made. These cancer cells settle into the bone environment, which is normally occupied by cells that produce and break down bone tissue. Sometimes, these disseminated tumor cells stay dormant for a period, meaning they do not grow or cause symptoms. But eventually, they can become active again, start dividing, and form new tumors within the bone. Once established, cancer cells interact with the bone's natural cells, like osteoblasts that build bone and osteoclasts that resorb or break down bone. This interaction disrupts the normal balance of bone remodeling, leading to either bone destruction or abnormal bone formation. This process creates a vicious cycle. Tumor cells stimulate osteoclasts to resorb bone, releasing growth factors stored in the bone, such as transforming growth factor beta. These growth factors then promote further tumor growth and bone destruction. The cancer cells can also manipulate the immune system, suppressing the activity of T cells and natural killer cells, which normally help fight off abnormal cells. Molecular pathways like transforming growth factor beta signaling, the Wnt pathway, and chemokine interactions involving CXCR4 and SDF help cancer cells migrate and settle in the bone. The unique environment of the bone, with its rich blood supply, constant remodeling, and growth factors, makes it an ideal place for cancer cells to grow. Depending on the type of cancer and its interactions, the bone may develop areas of excessive new bone formation or areas where bone is broken down. Understanding how secondary bone cancer develops is important because it helps doctors find better ways to treat it. Treatments often include systemic therapies like hormone therapy, radiation, or surgery, depending on the primary cancer and how much the bones are affected. Always remember, if you or someone you know is dealing with cancer, it's essential to consult healthcare professionals for personalized advice and care.